At some point, most lung cancer patients will exhaust all approved treatment options and have to rely on the next clinical trial as a lifeline. In fact, because of these clinical trials, there have been more treatment breakthroughs in the past 5 years than in the preceding 20 years. While COVID has certainly had an effect on the number of people who enroll to participate in trials, there's good news and help too. Lung cancer survivor Gina Hollenbeck and Dr. David Carbone join us right now. Gina, can you tell us your lung cancer story?
Sure. I was diagnosed in 2015. Lung cancer had already spread to my brain, so I was stage 4 lung cancer, and my only symptom was a cough. I was completely shocked as a nurse that someone with no risk factors could get lung cancer. And I had a really, really smart doctor who knew to test my lung cancer tumor and look at the DNA of it. And we found out that I was eligible for targeted therapy after I had biomarker testing. And so that targeted therapy has done a great job. I've had brain surgery, lung surgery, and I take a pill daily. And thanks to research, 5 years later, I'm still here.
Dr. Carbone, in general, in terms of research, where are we in regard to lung cancer?
Well, we've made amazing strides in the treatment of lung cancer over the last couple of decades. 20, 30 years ago, the average survival was 4 to 6 months. And today, we are, people like Gina would never be seen 20 years ago, where you're alive and good quality of life 5 years later. Because of research and because of clinical trials, we've discovered multiple new treatments for lung cancer, targeted therapies for genetic abnormalities in tumors, and new immunotherapies that have transformed the lives of lung cancer patients and even give us hope for a cure for metastatic disease. There have been more FDA approvals for lung cancer in the last 3 years than in the last 30. And this is really remarkable progress due to clinical trials and basic research.
Dr. Carbone, why are the clinical trials so important for the treatment of lung cancer?
Well, as we study what makes cancers tick and what drives them, we come up with ideas in the lab as to how to block that pathway or overcome that mechanism. But they have to be tested in people and proven to be better than the other treatments and proven to be safe. And that's what a clinical trial is. A clinical trial, in my mind, and what I tell my patients, is that it's giving patients access to tomorrow's treatments today. And this is how we've made this progress.
Gina, this is twofold. Do you feel safe enrolling in a clinical trial during COVID? And can you also explain your fundraising efforts and what it's going toward?
Sure. Well, I think that whenever you enroll in a clinical trial, the very first thing to do is ask questions and then ask more questions. So make sure you understand, what you're getting into and what is expected of you. And, once you do that, if you take it back to your medical team and, weigh the pros and cons, then, I think that you can really be sure that the medical professionals have your health and safety at the top of their priority list. So, they want to make sure they're keeping themselves safe and keeping us safe. And then as far as fundraising is concerned, the reason I actually have never really liked fundraising, but the reason that I do it is because there is critical research on the table. Before COVID ever existed, lung cancer was the #1 cancer killer of men and women. It kills more people than breast cancer, prostate cancer, or colon cancer, yet it's the least funded. And so that's why I had to step up my game and start fundraising for research. These researchers, we need smart people on the table trying to outsmart, this cancer. And in order to do that, it costs money. And so that's why I fundraise. And frankly, it means my life.
Dr. Carbone, you are one of those individuals who's on a mission to outsmart lung cancer, that's for sure, and we're lucky to have you on that team. But with COVID wreaking havoc on our lives in so many ways, how has it impacted the enrollment of new patients in clinical trials, and is it safe to enroll in a clinical trial?
Yeah. Well, COVID has affected every aspect of our lives, and it's affected medical research and both clinical and laboratory in a dramatic way. When it first hit hard a few months ago, we didn't really know how to react. A lot of things closed down. Our research laboratories virtually closed down. Our screening programs closed down. We limited access to hospitals. But in the last few months, we've been able to figure out how to keep safe. And with the wearing of protective equipment in the hospital, with screening of patients that come in, we've almost come back to normal clinical trials accrual from about a 70% reduction in clinical trials a few months ago to almost back to normal surgical schedules, normal screening practices. And I think it is safe now to go in to get your treatment for lung cancer, because it's very true that the lung cancer is a much greater risk to your life and livelihood and quality of life, even than COVID right now.
Gina, what do you say to lung cancer patients who are concerned about joining a clinical trial while we're still in the midst of the pandemic?
Yeah, I can understand the concern, but I do think that if you look at clinical trials are the reason that we've come up with these groundbreaking treatments within the last 5 years or so. In fact, we've come up with more treatments more than we have in the last 20 years. So I would say ask questions, make sure you understand what you're getting into, and know that in the midst of COVID, medical professionals want to keep themselves safe and want to keep you safe. And so I think that the safety as far as going in is there, and that medical professionals really want to keep you safe. I think that's at the top of their priority list.
Dr. Carbone, since COVID attacks the respiratory system and there's so much research that's being done right now, do you think there could be any COVID research that will be useful to lung cancer researchers?
Sure, we're always surprised about how basic research in one area can affect another area in a major way. One of the big problems with COVID is the immune system attacking the virus, but also causing inflammation in the lung, which causes the breathing problems. And one of our best therapies for lung cancer is immunotherapy, which also sometimes causes inflammation in the lungs. And better understanding how the immune system causes this undesired side effect of inflammation while preserving the efficacy against the virus and the cancer, really knowing that through COVID research could affect our ability and the safety of our treatments for lung cancer for sure.
And lastly, Gina, can you share any advice to those who are currently dealing with a lung cancer diagnosis?
Yeah, I think that getting help and support is the very most important thing. There are stories, and there's a great podcast that's about the first 7 days on LCFamerica.org that would really help people who are newly diagnosed. For people who've been diagnosed for a while, I think that just keeping hope, knowing that research is out there and clinical trials are being done is the most important thing, to hold on to that hope that new things are coming and that there are chances that we can make this disease non-existent.
Thank you so much, Dr. Carbone and Gina, for joining us today. For more information, visit lcfamerica.org.
George